Mental health and sports therapy go hand in hand, and it's very, very important. So let's get into it.
Okay, so you were talking about how physical activity, going to the gym, helped you to manage your stress or manage what's going on in your life. So then when you got injured, right, the way that you were previously coping with your challenges through physical activity, you couldn't do that anymore. Yeah. So maybe it felt like those things were building up and maybe you didn't know how to cope with it. You didn't know how to manage it. So maybe you can speak a little bit to how you coped with your problems during that time.
Yeah. So coping with it became really hard because of the lack of physical ability for what I really wanted to do. And I think it was different for both injuries. With my shoulder, my coping mechanism was a little bit of everything, just being distracted, like I told you, from being in a relationship to school. Yeah. And then really focusing on physical therapy. You know what I mean? Like putting in the work and feeling accomplished. You know what I mean? And that, I guess, is like a natural coping mechanism when you go through physical therapy, right? So with my knee, it was hard. You know, for me, coping just came from a lot of different things. It was just I don't even know. Here's the thing. I tried to do the same thing. Yeah. It wasn't working. I went to physical therapy for my knee, and I wasn't. I just wasn't motivated. You know. I just was like I was tired. Yeah. I was tired. Like it's like, damn, again. Like I just finished. You know, because 5 days before I tore my ACL, I was cleared 100% by my surgeon for my shoulder. So it was hard. Like it was really, really hard.
Must have felt like a major setback.
Yeah.
Like you're back to
exactly. And for me, like I'm so good with motivation. Like I'm good at motivating myself and at least trying to motivate others. You know, with a lot of different things, right? So I couldn't figure out a way to like cope with it in like a very, you know, like strategic and manageable way, right? Where I'm like, okay, like I'm good. Like you're good. You're building every day. I just kind of had to like just let it ride, you know? I had to take in the pain and the BS and everything that was thrown at me, you know what I mean? And so it's like it became difficult because I couldn't figure out a way to just get through it, right? But the thing is, I think going through that was me getting through it. Yeah. You know? And so it's just like sometimes you just got to go through it and just let it ride and just like, you know, let's let everything go, you know, sometimes. And just like let it play out the way it's supposed to be. And definitely now, like I'm feeling a lot better. You know, what is it, like 9 months, almost 10 months later? Yeah. And so it just took a lot of time, more time than I anticipated, which is fine. Am I where I want to be right now? No. But have I accepted it? Yes. Right? So I think the problem was me just accepting it, taking a long time to just accept it and just be patient, you know? Yeah. So my patience was a lot better with my shoulder than it was with my knee.
So probably looking back, I would imagine that in the moment, you probably were concerned about how am I going to get through this? You know, what am I going to do to cope with this? But now look where you are. Yeah. And you're even saying, like, I just addressed it head on. I don't know what I did, but I made it through. And I think that's just not only the beauty, but I think the strength of the human mind is that we adapt. We find ways to survive. We might not always know the best choices to make or the best ways to cope, but somehow we get through it. Yeah. And you made it through.
Yeah, definitely. Adaptability is super important. Not just with this, just in life in general. Yeah. You know, life is going to throw a lot of curveballs at you, and you just have to be able to learn how to adapt. Yeah. So that's I guess that's what I did. I just my mind just adapted on its own. It took a little bit more time, so it is what it is. Yeah. I've accepted it, you know.
Yeah. Good. I do want to, on the topic of coping, I did want to talk about the importance of managing your stress just in general. Let's say not only for those that are injured, but anyone that's engaging in physical activity in general, or if you're involved in a sport. So a lot of the research is tying stress to injury. And not only general life stress, but if you're going through a major life transition or a stressful life event, if you experience those and you're engaging in physical activity, you're at a higher likelihood of getting injured. And not only that, but your injury is going to be a lot more severe than your counterparts that aren't under stress. So to those of you that are engaging in physical activity, those of you that are in sports, monitor your stress levels. Make sure to be aware of the times that you're feeling overwhelmed, feeling really anxious, even frustrated or depressed, whatever it may be. Make sure you're managing that in the best way that you can. Seek help if you need to. Find ways to cope on your own. Because as I said before, if you're highly stressed out, if you have elevated stress levels and you go to the gym or you engage in a sport, you are now putting in yourself at risk. Because when your body is under stress, you are less likely to be able to flexibly adapt to
different movements.
So your body's going to be put under stress, and the injury is going to be more severe if your body's under stress. So
I agree with that 100%. I mean, I still was under stress going through, right before I hurt my knee. I was under a lot of stress. I had, a lot of personal problems, like when it came to my relationship with my ex-girlfriend, living at home with my parents, again, like kind of moving out, renting my own place, or renting out my place and then moving in with my parents, not like being done with school, trying to figure out career, all that kind of stuff. A lot of pressure and stress from all these different life events like you were talking about that kind of were engulfed inside of me. And then I'm sitting here now that I'm able to cope again, going to the gym. It's just maybe I just wasn't ready for this like full on, 100% into this activity again mentally. Yeah. So it affected me physically again.
And I think that's the caveat. And I think that's what makes this probably a little confusing, because we know that physical activity helps us with our stress. It improves our well-being, it improves our mental health. But, however, when your stress levels are at higher than average or at higher levels, that's when it's harmful to engage in physical activity. Yeah. So it actually has the complete opposite effect if you're more stressed than usual, or engaging in a major life change like graduating, trying to find a job, divorce, moving, all of these major transitions can cause a lot of stress on the body. So be mindful of the activities that you're engaging in, and be sure to monitor your stress levels and take care of yourself. So know that sometimes you'll need to take a break, right? You need to rest, you need to listen to your body, know what your body needs, and don't push yourself too hard, because you'll get hurt. Definitely.
And it's crazy because like I would make jokes, like it's like when we used to play basketball at the gym. It's like, don't bring your problems. We're coming here to get away from our issues and like just enjoy, don't start fights, don't whatever, just leave your problems outside of the gym kind of thing, right? Yeah. But that's the thing. It's like, people they have their own issues too. They bring it inside the gym, and it just, you can see it firsthand, and it sucks. I feel bad. I feel nothing but empathy for those people, honestly. But that's a real thing, man. That's crazy.
I was actually shocked when I saw that.
That's crazy thinking about it.
Thank you guys so much for watching. If you have made it this far, I highly appreciate it. I definitely think that these topics are very important. If you have any questions, please comment down below. Our IG information is down below. Hit us up, DM us on Instagram, Leanne or me. And if you do have any advice, or if you would seek some advice in certain ways, if you've been injured, ACL injury, AC joint separation, whatever it may be, even mental health and how to deal with it, I think it's very important. Definitely hit me up. I'm always, open to hearing different stories and, helping everybody out however I can. So anything positive, comment down below. Hit the like button down below. Subscribe to my channel. Thank you so much for watching. Take it easy.